thank you for joining me today as we get to talk about nutrition for the elderly. My name is Serah Karanja. I'm a registered clinical nutritionist by the KNDI. We also advise we can also advise on supplements, because you realize with old age comes issues with maybe even swallowing, indigestion. So you'll find that most nutrients are not properly absorbed. So you can bring in supplements just to supplement the diet that they're having, whereby if it's iron, we have some supplements to improve on that. If it's calcium, we have calcium supplements to also ensure that their bone density is okay. If it is maybe high energy, high protein supplements, to ensure that their bodies have the energy to maybe go about the activities that they go about during the day. So in case of protein supplements, they're just meant to cater for in cases of injury, or maybe where they have a wound, their muscles are able to be replenished and there is quick recovery on the same. So with the elderly, you might find that with different developments or with age, you'll find that most can't swallow well, most have indigestion issues, they are not able to absorb the nutrients they get from food. And with such conditions, or maybe with such instances, we advise for supplementation, just to ensure that whatever nutrient they are not getting, they are able to get it from a supplement in addition to what they are eating or the diet they are having. So it's not for everyone. As I said, nutrition for the elderly will differ from one elderly person to another elderly person. So you'll find that for most won't have supplements, or maybe won't need a regular supplementation, and others will need regular supplementation. So I would advise if you come to realize, or you have visited your dietitian or nutritionist and they have advised that we supplement, it's because we have realized that the elderly person or this person is not able to get adequate nutrition in a day from just normal diet. So we advise for supplementation at that point. So this is individualized. It's not for everyone. It depends with that person's health status, that person's nutrition status, and even their level of activity at that point. For an elderly person, I would advise for supplements that just help to boost, or just to ensure that they get adequate nutrients. I would advise for calcium supplements for the sake of bone density, or maybe to ensure that they have strong bones. I would advise for high energy, high protein supplements, depending on the health status of that person, and also depending on the activity level. So before you supplement an elderly person, as a nutritionist, as a doctor, or maybe as a caregiver, look into evaluating what they're having at that time and getting to see what they need, so that we don't give a supplement that is not intended for that person. So everything is personalized at this point. So we have to evaluate an elderly person and get to see what are they missing from the diet, and then we can decide on the supplement to give. As we look into nutrition throughout the life cycle, you can book for my services at ponea.com. As I look forward to engaging in more discussion in nutrition, in disease management, throughout the life cycle from childhood to elderly ages, and also to ensure that even you who is looking just to get to know what a nutritious diet is, or maybe healthy diet is, we get to discuss that. As for everyone, we always individualize every person, so that we ensure that the nutrition requirements for this person are met. So thank you so much for joining me. I look forward to more discussions over the same.